What's going on, guys, and welcome back to another video. So over the past few weeks we've been hearing the same thing. We need help the American people, provide more assistance to those that are in need. And it seems like our asks, our requests, our responses have really gone unanswered. Lawmakers have not pushed for more for the American people, but according to many reports, they are saying that, or the reports are saying that lawmakers are hopefully going to provide more assistance to those that are truly in need. But in order to do this, here's the problem. It's going to take time. Time that many Americans do not have. Many Americans are worried about how they're going to put their next meal on the table, how they're going to pay their next car payment or house payment. What are they going to do to go and get a job? Nobody's really hiring. And I see this all the time, and I see the reports that there's millions and millions of jobs and millions of people that aren't working, but why aren't those jobs being filled? There's a lot of issues there. But in today's video, I want to give you a little bit of an update as to what we're seeing regarding the stimulus package potentially passing. And again, it's not going to pass in 2021. That is completely out of the question. It will pass sometime in 2022. I am assuming it's going to pass. I'd say about 95% chance it passes in 2022. Most likely the end of January, potentially even February. I wouldn't think it would go into March, but it could. But we will address that in today's video. We also got some mask fears that I want to bring to your attention because you may be wearing the wrong mask. And that's what's causing this Omicron variant to surge at this time. So let me bring you all those updates in today's video. Like always, thank you guys for watching. Thank you guys for always hitting that like button and asking the questions down in the comment section, because I use those questions to tell what you guys want to hear more about, and I create videos on that. So let's get into the update. Americans need more help. What we know is the pandemic really took a toll on millions of people, but they have still not recovered because of it. What we are hearing is that Democrats plan to scale back the Build Back Better Act in order to get it passed. The only problem right now is that how low are they willing to go? And how low is Senator Joe Manchin willing to go in order to accept a bill that he may or may not really want? He may not support it. Here's what I can tell you. There won't be stimulus checks. Stimulus checks are not going to be included into this next bill. It doesn't matter how many people push for them, how many people need them. A stimulus check won't be included because Senator Joe Manchin has already stated no free handouts. And the second thing, nothing that will cause inflation to go up. A stimulus check would do just that. It would still benefit the American people, but it would cause inflation to tick up. That's the issue. We also know Medicare will not be fully expanded. It could potentially include hearing, but even that was one of the things that was questionable and was on the table. Many were saying that wasn't going to get passed either. But here's some of the questions. Will more help be there for people on Social Security? Because that's what President Biden promised. In order for him to get into office, he promised people on Social Security, I'm going to provide $200 per month as a bonus on top of what you're already receiving. Hasn't happened, and it will not happen. We also know President Biden didn't provide much for people that were carrying a student loan. Yeah, he's pushing back the payment pause another 3 months, but what was that really him, or was it the education department? Well, who knows? Will rental assistance come at a faster pace? Because right now, many are saying they've been in the queue for months and they cannot get their rental assistance, and their landlords are waiting for the money. Well, they're going to have to keep waiting because that money is so slow. What about those that are still looking for work? Are they going to see more help? Is there going to be more benefits for people on unemployment? Or is there going to be an extension of unemployment for people that ran out of their allotted weeks? We don't know. That's the question. And these are all questions that the American people are facing right now in this very tough time. But here's what I can tell you. What I can tell you is that progressives are pushing for more. But many Democrats, as of right now, are actually wondering if the promises that progressives made, is that hurting them with the negotiation process? And I can tell you yes, because progressives, they promised the moon, right? Some of their provisions I thought were really good. Some were a little bit out there, maybe providing a little bit too much. But at the same time, they were good. They were going to help out the American people. But many moderates are wondering, is that the right move to pass a $1.75 trillion bill? Even though progressives want more, they say the best thing to do is potentially not pass a $1.75 trillion infrastructure bill, pass something even smaller, because right now inflation is hurting every single person in the United States. And that bill would have only sped it up. Well, right now here's what I can tell you. Moderates say that a smaller bill is most likely the only option because too many Democrats are hiding the true cost of the $1.75 trillion bill. Some say that this is going to be somewhere between $2.5 and $3 trillion when it's all said and done. And even the CBO came out and said it could potentially be $3 trillion after 10 years of running the entire provisions through. So we'll see what happens there. But here's what we know. There's a lot of discussions happening pretty much behind closed doors, over the phone, over probably Zoom meetings between lawmakers. We're not going to hear a lot of these reports. We're not going to see a lot of these updates. Here's the reason why. Many have made it very clear that when you negotiate out in public, the problem is the public or the media, I guess I would be considered media as well, they bring these stories to the forefront of the news, and then the public sees it and they're like, oh, we're discussing this? Finally, this is awesome. And then it ends up just completely falling out of the bill, and everyone's like, hey, what about that? Right? Remember those $800 or $1,000 stimulus checks that were going to go to seniors? This was going to help them cover the cost of hearing and dental and vision in the Medicare expansion, right? And then what happened there? Or additional stimulus checks, the fourth stimulus check that many were saying, yeah, it's going to be in there. We have to have a fourth stimulus check. Then guess what? Wasn't in there. Then the American people are like, hey, what about us? So that's why some are saying we just cannot negotiate in front of the public, because if we do that, they're going to see what we've been discussing, and when we can't pass it for whatever reason, we look like the bad guy. So we'll see. We will see what happens. But as of right now, yes, lawmakers are looking into providing more assistance to the American people, but, and here's the key, only the people that truly need the assistance. And when I say truly need it, I'm talking about people that make very little money, do not have a job, do not have Social Security income, right? Pretty much people that have absolutely nothing. That's who they're considering helping. And again, I think those people need help. But at the same time, there's others that need help too, that are working, that are on Social Security, and they need assistance as well. So we're going to see what happens, but right now, I'm not extremely optimistic that we're going to see a lot of really good provisions, really good policies moving forward. So we'll see. I'm hoping I'm wrong. But here's what I can tell you regarding the mask fears. We've been in this pandemic for, coming up on 2 years? 18 months, 19, 20 months, something like that? Okay? And experts are now telling us, we've been getting a lot more reports of this over the past, probably 2 weeks. But experts are now telling us that a cloth mask is not what you should be wearing. They say no. You should not be wearing a cloth mask. Even though we've been telling you guys to wear a cloth mask for the past 2 years, you shouldn't wear a cloth mask. They say this is probably what is causing the increase of COVID cases. They say that cloth masks are pretty much just a decoration for your face. And they say a cloth mask doesn't actually block out Omicron. And more people need to start wearing the N95 mask, which is what doctors a lot of times are using. People in the health field are using these N95s. Or they say, at least use a 3-ply surgical mask. That would be the minimum that they'd recommend. That is one of the things that I usually wear as well, is a 3-ply surgical mask. I do have some N95s. If I'm really around a lot of people, not sure how they're feeling, I would wear an N95 and potentially put a 3-ply surgical mask over the top of that as well, just to kind of dress it up. But that's just me. I like to stay safe. But it's because of the need for a better mask that many health experts, and here's where the mask fears come in. Many health experts worry that they could simply be left without proper protective equipment at work if more Americans start to stockpile with the N95s. Here's the problem. We saw this in the beginning of the pandemic where health professionals, nurses, doctors, right, receptionists, doesn't matter, right? Anybody in a hospital, clinic, they were having issues because they had to reuse their N95s for potentially days, if not weeks. They had to reuse a mask. And that was the issue. And many started to contract COVID. And so then they started to stockpile these masks. Well, that's the worry now is, what if the American people are being told, yes, go get the N95s, but at the same time, by them going to get it, it leaves a shortage in the healthcare field. What happens then? Hospitals, clinics begin to shut down. That's not what we need. Now, we do have some decent news regarding the Omicron variant, though. According to multiple health experts, they anticipate that Omicron will peak sometime in January, and it could actually see a somewhat bottom sometime in March. Now, I said this exact same thing, I think it was just the other day, that chances are over the next 2 weeks, it's going to be about a week to 2 weeks after January 1st, so after the New Year's celebrations, we would most likely see it peak. After that, we'd see it somewhat subside. Now, is it going to take 2 months? Yeah, potentially it's going to take 2 months just to get over this, just to get through this. Is it ever going to go away? No. But here's what experts are saying. If the Omicron variant turns into a common cold, then we learn to live with it. We learn to live with it. We provide additional vaccines. We provide pills and medication like what Pfizer and Merck were authorized to provide. So if that's the case, chances are we're going to have a decent amount of pills coming out in March, April, May, June. So potentially this summer could be a great summer. So we'll see what happens. But as always, that's what we know as of today. If I hear any other news, and I promise I will provide you with more updates. But tomorrow I will probably just do maybe 1, maybe 2 videos if there's any great news that comes out. But I will be spending the next couple of days with my family. But I do promise, okay, I will be back tomorrow morning, and I will do a video on Christmas morning as well. Because honestly, I want to provide you with the updates. I want to provide you with the factual news of what we are hearing and seeing. So if you have any questions whatsoever, please ask your questions down in the comment section below. Again, just want to thank you guys for watching. Have a wonderful rest of your day. Consider subscribing, and I'll see you guys on the next one.